Churchill Downs, the effects of performance-enhancing drugs in the horse racing industry. Horse racing has always been a popular spectator sport and has continued to gain popularity over time. However, the rising issue of the use of performance-enhancing drugs in the horse racing industry is causing the sport to slowly lose popularity. A concern is growing for the health of the horses and the negative effects these drugs have on the horses. Some of the performance-enhancing drugs include milkshakes, therapeutic medications, caffeine, and anabolic steroids. Phenylbutazone, estrone, fluoxetine, hyaluronic acid, Lasix are examples of drugs used on a horse who is diagnosed with joint disease and was euthanized due to the effects of these drugs. Phenylbutazone is a painkiller, estrone is for hemorrhaging prevention, Flunix is a painkiller, hyaluronic acid loosens joints, and Lasix prevent bleeding.
The use of performance-enhancing drugs have negative effects on the horse's behavior, which can result in dangerous results for the horse and/or the jockey or trainer. For example, the more aggressive and unpredictable behavior can create a sense of fear in the jockey and can cause a disconnected relationship between the jockey and the horse. According to Sue McDowell, head of the Equine Behavior Program at the University of Pennsylvania's New Bolton Center, says horses on ABS often have more of a sour disposition and are more aggressive and unpredictable.
In contrast to the behavioral effects, there are also negative effects on the horse's reproductive system. For example, interference with semen production, delayed puberty, and a decrease in testicular size are all negative effects on the use of the anabolic steroids such as boldenone and stanzolol. Boldenone increases protein production in the muscles to enhance muscular endurance for the races, whereas stanzolol is just a man-made version of testosterone and is less threatening than boldenone.
In contrast to the behavioral effects, there are also negative effects on the horse's reproductive system. For example, interference with semen production, delayed puberty, and a decrease in testicular size are all negative effects of the use of anabolic steroids such as boldenone and stanzolol. Boldenone increases protein production in the muscles to enhance muscular endurance for the races, whereas stanzolol is just a man-made version of the testosterone and is less threatening than boldenone.
Churchill Downs, home of the Kentucky Derby, is one of the most renowned racetracks and is a reputable example for the restrictions and regulations being implemented to prevent the dangers of the use of performance-enhancing drugs. One of the implementations established by Churchill Downs is winning horses are regulated to super testing by TOBA, Thoroughbred Owners and Breeders Association, for the presence of performance-enhancing drugs. This tests for more than 100 drugs.
Churchill Downs has also adopted a rule on anabolic steroids from the Association of Racing Commissioners International based on the Racing Medication and Testing Consortium recommendations, which eliminates all of the use of anabolic steroids in the industry. The super testing will not only ensure that thoroughbreds in competition receive safe and warranted medication, but it also increases the integrity of the outcome on each race.